Hi, I'm Josh Ratner, and welcome to HealthAlliance and You, a health and wellness series brought to you by HealthAlliance of the Hudson Valley. After skin cancer, breast cancer is the most common cancer among women. About 1 in 8 women in the United States will develop invasive breast cancer during their lifetime, no matter their race or ethnicity. Death rates are going down, largely because of early detection through screening and increased awareness. Here to talk with us is board-certified surgeon Dr. Zoe Weinstein, Medical Director of HealthAlliance's Center for Breast Health.
The way we think about breast cancer development is that we think that many women have an increased risk of breast cancer. We're always trying to assess who has this risk and who doesn't have the risk and tailor their screening for breast cancer appropriately. Once you get to be of a mature female, you need a breast exam by a healthcare professional every year. Ideally, it's someone who does the breast exam every year, who gets used to your specific anatomy as the patient. We don't really know one insulting agent, one factor in the environment, one behavior that will precipitate a breast cancer in a patient. But most new cases of breast cancer every year are diagnosed in women without a family history of breast cancer. So we hate to tailor our screening to a patient with a family history of breast cancer. We really want to assess every patient individually and look for other risk factors for breast cancer. If a patient has a diagnosis of breast cancer, it's usually made through a biopsy of the breast tissue. Once a patient's diagnosed with breast cancer, they're really on the beginning of a path that requires the help of multiple specialists to figure out what is the best treatment plan for that person. So every breast cancer has its own biology. And it's very important to understand the biology of every patient's tumor because the biology of the tumor dictates the treatment. Biopsy of the tissue gives us an idea of what is the biology of this tumor, what kind of receptors do the cells have, what is the best way to treat this tumor, because when patients come with inflammatory carcinoma, the next step is not for them to have surgery, it's usually for them to have chemotherapy. Unless you really understand how the patient looks and the biology of the tumor, the next step is not always so clear. There are a lot of issues that are raised in terms of your sexuality with a breast cancer diagnosis. It isn't always specifically related to the cosmetics of the breast. But sometimes when patients are getting anti-estrogen therapy, their breasts may look okay, but the patient may be suffering from side effects related to estrogen depletion. So a lot of women struggle not just with the after effects of surgery on the breast, but really the effects of some of the treatments that we give them for their breast cancer. We want them to live, and we want them to live well, but we also have to be aware that some of our treatments really affect their sexuality, their ability to maintain their level of intimacy with their partner, and we do try to address this in our patient population. We have a comprehensive care plan for breast cancer patients here at the HealthAlliance of the Hudson Valley. We really try to meet all of the needs of a patient who has a breast cancer diagnosis. We achieve that by having a multi-specialty team of people, doctors, pastoral care, social workers who help treat the patient as a whole. The HealthAlliance has the most robust cancer support program in the area. They have support groups, they have cooking classes, exercise classes, memoir writing groups. The stress involved with breast cancer diagnosis can be extreme. We have a lot of patients who are impoverished. We have patients who have small children. We have patients who are isolated and don't have family members who can help them. And these patients would not do well from their cancer diagnosis without the support that they get from our cancer support programs. So we really do offer comprehensive care here.
We hope this segment inspired you to support your health. Remember, if you're a woman age 40 and over, take care of yourself and get a mammogram every year. Your chances of surviving breast cancer are much better if it's found early. And if you're diagnosed with breast cancer, don't lose hope. HealthAlliance has one of the most advanced, comprehensive breast health centers in the region. Our certified patient navigator will connect you to our renowned team of specialists. For more health information or to view this episode again, visit hahv.org. I'm Josh Ratner. Join us again next time for another segment of HealthAlliance and You.